For over a year, experts have been studying a rare COVID-19 complication affecting children known as MIS-C. It remains a very rare disease, but with the new school year approaching and with children under 12 without an approved vaccine, some parents are wondering how much of a risk this illness will be. I spoke with Dr. Ray Young, a U of T professor and staff physician here at Sick Kids, about the issue.
Kids are so asymptomatic during the acute phase of COVID, but unfortunately, in the rare child, a month later, they will get MIS-C.
It stands for multisystem inflammatory syndrome and usually appears 2 to 6 weeks after a COVID-19 infection. Symptoms vary but typically include a high fever, rash, abdominal pain, and swollen hands or feet. Experts are still trying to determine why some kids may develop MIS-C and not others. In the U.S. and Canada, the disease appears to predominantly affect racialized children, but Dr. Young says it may not be genetics driving that number.
Our racialized populations are much more affected with COVID because of employment and environment and other very important factors. So their children are much more affected with MIS-C. And when we did a head-to-head comparison looking at COVID incidence and MIS-C incidence, looking at it subdivided and stratified by ethnicity, it falls out exactly.
Doctors are also still trying to understand what triggers such an extreme immune response. New data gaining traction in the U.S. suggests the disease is more similar to toxic shock syndrome, an illness most commonly associated with tampon use. Dr. Young is skeptical.
It continues to be a very hotly debated topic. It is not universally accepted. In fact, I would say that only a very, very small minority of the groups believe in this.
As parents consider sending their kids back to in-person learning in the fall, concerns about MIS-C are growing. Dr. Young is urging continued safety measures like washing hands and distancing. But for everyone who can get the shot,
immunize, protect children by immunizing yourself. Immunize the kids that are able to be immunized. And I think this is really the message.
Sick Kids has treated 190 cases of MIS-C since the first wave of the pandemic. All of them have recovered. Nationally, Health Canada says there have been 250 reports of MIS-C across the country, but the Canadian Pediatric Society says they still have up to 600 cases that have yet to be classified. In Toronto, Natividad, City News.